Neonatal hearing test. Neonatal hearing test is performed in a newborn baby to determine if the patient has a hearing loss. There are two types of newborn hearing screening methods are there, which is acoustic emission test, or OAE, or auditory brain stem response. Autoacoustic emission test, where a miniature earphone or a microphone is placed in the ear and sounds are played and the response is measured. If the patient or the baby hears normally, an echo may be reflected back into the ear canal and is measured by the microphone. When the baby has hearing loss or impaired hearing, no echo or reduced echo can be measured on a OEE test. Auditory brainstem response, where the testing is which is the best test available for newborns and infants up to about 5 or 6 months of age. The sounds are played in the baby's ear canal and electrodes are placed on the baby's head to detect the responses. Sounds are presented to the ears using small earphones, where the electrodes picks up the response from the auditory nerve and is measured via computer.